When you become pregnant, you might start thinking about your overall health. Exercise can be a big part of that equation. I'm Siobhan Dolan, and today we're going to talk about exercise. Guidelines suggest that most pregnant women should exercise 30 minutes a day, most days of the week. If you exercise, it'll definitely help you build stronger bones, muscles, and joints. It can also help you develop your stamina, which may be helpful in labor and delivery. We know that exercise helps people with preventing heart disease, diabetes, gestational diabetes, and long-term health. Now, if you've already been exercising, there are some changes you might need to make due to your pregnancy. If you haven't been exercising and you plan to start exercising now that you're pregnant, definitely talk to your health provider before you get started. There's lots of good exercises you can do, but you want to make sure you're medically cleared to exercise. Exercise during pregnancy may be unsafe if you have heart disease, lung disease, a short cervix, preterm labor, multiple pregnancy, that's being pregnant with twins, triplets, or more, frequent vaginal bleeding during months 4 through 9, placenta previa, or high blood pressure. What kind of exercise have all of you undertaken while you're pregnant?
Walking 30 minutes a day with either my mom or my sister.
If you do exercises like volleyball or basketball or soccer, where you could actually physically hit into teammates and so forth, those are best to avoid. Other sports that you should avoid because you may increase your risk of falling are sports like skiing, horseback riding, and gymnastics. Now, sit-ups are something to avoid during pregnancy, and the reason being is that you don't want to lie flat on your back while you're pregnant. A lot of it has to do with the blood flow during pregnancy, and so better to avoid those. Other exercises to avoid are deep knee bends and toe touches. In terms of where to exercise, what you want to have is a safe space with a hard surface floor. You can then use either some carpeting or a yoga mat as a way to soften the floor. You want an area where you're stable and you can keep your balance. Most pregnant women want to be comfortable. What you want to get is some loose-fitting exercise clothing, but a supportive sports bra. You also want to wear appropriate footwear, which is usually sneakers, which are comfortable and protect your feet. Stop exercising if you have these warning signs: trouble breathing, vaginal bleeding, dizziness, headache, chest pains, weak muscles, calf pain or swelling, preterm labor, decreased movement of the baby, or leakage of fluid from the vagina. You and the baby are the most important concerns during pregnancy, so exercise for keeping both you and your baby healthy. Remember, exercise is healthy and safe for most pregnant women. Talk to your health provider about exercising during pregnancy. Stop exercising immediately if you don't feel well. Visit marchofdimes.com to learn more about exercise during pregnancy.